Hi, I'm Megan, and welcome to Girl Talk. This episode is the second part of our series about infertility with Prof. Huang Zhongwei. If you'd like an introduction to Prof. Huang and the topic of infertility at large, do watch the first episode. In this episode, we will find out about what to expect at your first consultation for infertility and explore various treatment options. As usual, do remember to like, subscribe, and share Girl Talk on all our social media platforms. And now, let's have a Girl Talk. Hi, Prof. Thanks for joining us in part 2. Now, we'll be shifting the focus a little bit more about the medical consultation for infertility.
Right.
So if we could jump straight into it, when should I consult a doctor for infertility?
Well, it really depends on a couple's unique issues that they might have.
Right.
I always find that couples are shy and sensitive about certain issues to talk about. So for the woman, her age is something that I will take more consideration. And I think many women also realize this now, which is a great thing. So if a woman who is above 35 years of age, I think that's something that she should be worried about if she has problems conceiving or have some concerns about that. In particular, if the couple, either man or woman, have any medical conditions that may affect their fertility status or affect the pregnancy outcomes, for example, like diabetes, chronic diseases, hypertension, or long-term medications for conditions like rheumatoid arthritis. I think some of these conditions may warrant a couple to be assessed earlier.
Right.
And as I mentioned earlier in our episode 1, if you still remember, if either of the man or woman have cancer treatment or medications that may be potentially harmful to their ovaries or testes, they should take note and they should come forward to seek fertility assessment earlier.
Right. Okay. So once again, just a very quick reminder, for more information about the things that Prof mentioned in the previous episode, you can hit there to watch that before coming back to this part. So I guess continuing from that, Prof, how in that case should I prepare for this visit? Is there anything that I need to do beforehand before I consult the doctor?
I think fertility is the condition for both men and women. The couple should come together so such that the doctor can assess their problems uniquely as a couple. And I think many couples come to the clinic feeling very tense and anxious, but do be prepared to just come with an open mind, and that if you have questions ready, feel free to discuss with the doctor sitting in front of you. Importantly, we also talk about the reproductive health history, sexual history, and I think these are things that if a couple are uncomfortable about, they might need to be ready to talk about them, because these issues itself may affect their problems with fertility as a couple.
I see, Prof. I think it's very nice to know that at least the doctors will be there and be very ready to support each couple through this. Actually, Prof, because in part 1, you mentioned about how fertility is very much related to your general health as well. In that case, would maybe like a health screening before that be necessary before coming to the doctor?
There are more and more services now, which you term as pre-conception services. And I think a number of family physicians, polyclinics as well, if you are Singapore citizens and permanent residents, they do a general health screening. And I think that is an ideal situation for every couple who are trying to conceive, because general health actually predicts reproductive outcomes and vice versa. So I think it's also good to understand about the general health even before they try to embark on their conception journey. I've told many women, if you have existing medical problems and these are not well controlled, it will not be ideal to conceive or even carry the pregnancy.
I see. Okay, Prof. And say someone is ready to book their appointment, what should they expect at their first consultation?
We will have a very frank and open discussion about their medical history, reproductive health and sexual history. And also we will do targeted physical examination for the woman and sometimes the man, if we think that there might be risk factors. It will be a private examination because we will assess the reproductive systems of both men and women. And so usually fertility doctors are either gynecologists, and sometimes the men may seek help from a urologist if they suspect they have a male-related fertility issue as well. After the history taking and the physical examination, we will try to ascertain what could be their fertility problems by performing further investigations from the bloods, ultrasound scans, and for the men, a semen analysis.
I see. So, Prof, I don't know, sometimes people look at, going to the gynecologist as a relatively scary thing. Are there any invasive tests or very painful procedures that we should brace ourselves for?
That is a very good question, Megan. And I think that every woman will always feel that it's a very private yet it's like intrusive examination. We will need to assess the gynecologic exam, which involves examining the vagina, cervix to make sure it's healthy. We'll need to do a transvaginal ultrasound scan to assess the womb and the ovaries to look out for any problems as well. And in some circumstances, which we will offer, we is to examine the status of the fallopian tube, which is, as mentioned in the first episode, that is where the egg and sperm naturally meets. Now, all these tests may be uncomfortable, but usually they are tolerated by most women, and they do not bring a lot of pain.
I see.
Yeah.
Okay, sure. And I mean, I'm sure the doctors would take you through each step, holding your hand and making sure that you're all right through it, right?
Absolutely.
And so, Prof, actually, you mentioned just now about some fertility testing. And one thing you mentioned that for the men, they can consider is this thing called semen analysis. Would that be what we commonly know as like a sperm count by any chance?
Yes. So the semen analysis does look at more than just a sperm count alone.
Right.
We look at the sperm count. We will also calculate the sperm concentration in the semen sample. But there are also other things we looked at. For example, how motile the sperm, which is very important because this sperm needs to be swimming and alive to reach the far end of fallopian tube where the egg is when it's ovulated. We also look at how the sperm looks like, with what term the sperm morphology. And this is all in accordance with the World Health Organization semen analysis parameters.
Okay, so essentially there's a lot more that actually goes into sperm counts.
Precisely. And this is something that I urge all men to really cooperate with a fertility doctor during the assessment, because that's the only first test that we do for men.
I see.
Whereas for women, we do so many more other tests to ascertain her readiness for fertility assessment.
One more test that we can talk about for women that most people kind of get a little bit afraid of is the test that apparently checks the patency of the fallopian tube.
Yes.
Could you tell us a bit more about that?
I must say many women don't like the test to check the fallopian tube. It is definitely a more invasive test and can cause some cramps during the procedure.
I see.
What we do is actually putting a tube through the neck of the womb and then after that injecting a dye or fluid into the womb cavity and ensure that it flows up from the fallopian tube to show that it remains open. And that injection into the womb cavity, this fluid can cause a bit of cramps into the womb itself. Many women I looked after do not like this. They are very scared. But I guess once they know what the test is about and how it's being carried out, actually many women tolerate the test very well.
I see.
And also we advise the patient that if you're going for the test, you can actually have some painkillers taken before the test is carried out.
I see.
Yeah. So I feel that the woman understands what the test is for and how it's being carried out. She actually will feel less anxious and the test become more tolerable.
Right. So just to clarify, Prof, if someone goes for the test, they don't actually need to do any anesthesia or anything?
I don't think it's necessary to go under anesthesia. Most women tolerate the test, and the test is typically done on the day 7 to day 10 from the first day of a period. So this is just a time where most women have finished their periods and less likely to fall pregnant. Because this test, at some centers, we use X-ray to determine the flow of the fluid from the tubes. And so we do not want a woman having any chance of pregnancy to undergo this test.
I see. And Prof, just for everybody, in case they might want to go up and read up a little bit more about this test, what is the normal medical term that we use for this?
It's a huge term, Megan, and it's called Hysterosalpingogram.
Wow,
Yes.
that is very long.
Yes, there are some very good websites, and I believe that you can help provide some of the links for any of women who are looking at your podcast.
Yeah. Thanks, Prof, for that. And I guess because this test is about checking the patency of your fallopian tubes, right? Wouldn't I know if my fallopian tubes are blocked because my period blood just wouldn't flow out?
So that is one of the misconceptions that many women think about. Like, if my blood didn't flow out, where does it flow out? And is it going to cause me problems? There are many causes on why women do not have regular periods and why menstrual blood may come in drips and drabs and not what she expected. So if a woman have any abnormal bleeding or she felt that her periods have changed from the original pattern, then she should see the gynecologist earlier to assess better. But that's not an indication that the fallopian tubes have problems,
I see.
or the fallopian tubes are healthy as well.
In converse, would that mean that I could still have regular periods but have blocked fallopian tubes?
Absolutely.
Wow.
Yeah,
Okay.
because the menstrual blood actually comes from the womb, and it's actually coming from the womb cavity where the lining changes every month
I see.
in response to the hormonal changes that happens in the ovaries.
I see. Thanks so much for that, Prof. And now if we could just like move on a little bit into about the treatment options that are available for fertility. If we just start with the least invasive things that we can do, what are some lifestyle changes that we can implement to improve fertility?
Excellent question, Megan, and something that I preach a lot in the clinic, because every couple is different. And in our local context in Singapore, I realize that many couples are stressed.
Yeah.
They're not sleeping enough. They are not having enough self-care, and I don't mean by just going to the gym alone or just doing Pilates as and when they like it, but really developing a healthy lifestyle.
Yeah.
This sounds very easy, but having a good quality 7 hours of rest every night, reducing the stress, because many of us are working in a very high stress environment. And of course, if I will always check the body mass index of the woman as well as the man who comes to the clinic. And if any of them are not in the healthy body mass index range, I will definitely advise them on even their dietary lifestyle as well.
I see. Okay.
This is important because we know that nutrition as well as physical activities are closely associated with general health. And I think we did mention earlier on that general health is also very important when they start on their conception journey. Another important thing that I will always advise a couple to stop is smoking. That there are enough data that shows that smoking affects both the eggs and sperm.
Wow. Okay.
And this is something that every couple who really want to go on the conception journey, I would advise no smoking.
Yeah. In that same vein then, when we're talking about general health, are there any supplements or vitamins we can take to help fertility?
A very common question asked by couples all the time. They always wanted something they can eat and maybe not do anything about. But from the data available, a woman should always be started on folic acid. I think that is has known that will help prevent any brain development and nervous system development issues when she gets pregnant. So I think for it's a must for women. And for men itself, I think avoidance of high heat environment actually is important, because sperm production actually takes place at 1 to 2 degrees Celsius lower than the body core temperature.
I see.
So if a man is wearing tight tights and always working in high heat environments, for example, certain chefs, I have to mention that because they're always in front of the fire. Yeah, this could really bring a high heat environment and can affect the quality of the sperm that's being produced. Many couples are also looking for other supplements, and I would say that a balanced diet that's good in all antioxidants will be healthy and vital for good preconception health. There are some studies that shows that supplements like coenzyme Q10 may be a bit helpful to reduce oxidative stress to the body, and part of the antioxidants milieu that can be helpful as well. And in women, I always emphasize that they should have enough calcium and vitamin D, which is important not just for potential fertility and reproductive health, but also important for their muscular and bone health. So I'll advise women to have enough of that nutrients and micronutrients in their daily diet as well.
Sure. And, as a fertility specialist yourself, Prof, maybe you could just go very briefly into what are the other options from there. So say the lifestyle changes don't really work and they're not very effective. What else can you do or can you offer as a fertility specialist?
Right. So I think everything has to go hand in hand. Lifestyle modifications, if there are some issues, then we need to handle them. But depending on the couple's fertility assessment, we will have to move on and then to go into assisted fertility treatments. So it really has to be individualized to the couple themselves. Options such as intrauterine insemination and in vitro fertilization will have to be offered as the next step of treatment.
Yeah, Prof. I think the whole idea of assisted reproduction is a very big topic that hopefully we can address next time as well.
Excellent.
And so I guess as our final question to conclude everything, the same question sort of stands for every single person. If I'm having some problems or some trouble getting pregnant, what exactly should my next step be?
If a couple is really planning for conception, they should still see the fertility doctor as soon as possible. Sometimes doctors may say, oh, you're in such a rush. But I still feel that it's important that a couple who are keen to start a family to have their general health checked, and as well as having a fertility assessment done as soon as possible. Like I say, there are many times where a couple may look generally healthy and well, but may have problems in trying to conceive. And some of these conditions, we can only ascertain them when we perform fertility assessment for these couples.
I see. Well, thank you so much for staying with us for these 2 episodes, Prof. With that, we've come to the end of our series here on infertility, where we really covered into the second part about what to expect in the consultation and some treatment options regarding infertility. So if you've enjoyed it, remember to like, subscribe, and to favorite this podcast and this episode. And with that, we've come to the end. My name's Megan, and thanks for coming to our Girl Talk. Hi, thanks for watching this episode of Girl Talk. If you enjoyed it, feel free to like, subscribe, favorite, and follow Girl Talk on all our social media platforms. We hope to see you on our next episode.